Welcome everyone to today's webinar, How Patient Engagement Impacts Revenue Cycle Management. On behalf of Becker's Healthcare, thank you so much for joining us today. Before we start off, I'm going to walk through just a few quick housekeeping instructions here. So first, we will begin today's webinar with a presentation, and we will have time at the end of the hour for a question and answer session. So you can go ahead and use the Q&A box on your screen to submit any questions that you have throughout the presentation. There will also be a series of poll questions throughout the webinar, so those will appear on the slide where you can select the answer that best applies to you, and we appreciate your participation there. Today's session is also being recorded, and it will be available after the event, so you can use the same link that you used to log into today's webinar to access that recording once it's available. And if at any time you don't see your slides moving, or if you have trouble with the audio, just try refreshing your browser. And you can also use that same Q&A box to submit any technical questions that you might have. We're here to help with those. And with that, I'm pleased to welcome today's speakers. First, we have Fred Sheffield. He is the Chief Revenue Officer for HealthPay24. Fred Sheffield provides leadership and growth strategy for HealthPay24. He leads a team of marketing and business development professionals passionate about helping the health industry engage with their consumers by providing a holistic financial experience. With more than 20 years in the healthcare field, Fred has dedicated his career to improving the consumer experience and enhancing the provider-patient relationship. And next we have Reed Storch, the Chief Revenue Officer at Bugle. He has spent the last 30 years working with physician practices to create successful business relationships in RCM, EHR, practice management, patient engagement and access, compliance, operations, and financial and strategic management. Fred and Reed, thank you so much for being here today. Fred, I'll now go ahead and turn the floor over to you.
Thank you, Erica. Appreciate that. Hello, everyone, and thank you for taking the time to join us today. I thought we would kick things off with a little fun trivia question here, and I'm going to explain, what this means as you guys answer this. But to kind of kick things off, ask this question: how many miles of coastline does Hawaii have? About 750, almost 900, nearly 500, or over 1,100? And I'll give everyone a chance to answer that. And I'm going to explain why we're asking this question and why we're starting out a presentation on financial engagement, talking about Hawaii. Well, if you're like my household, you're probably a little bit tired of being all cooped up. It's been over a year now that we've been kind of inside, and we're as a family, we're starting to talk about, where do we want to plan our first vacation? Where do we want to go now that we've all been vaccinated and travel restrictions are starting to loosen up? And one of our most favorite places to go is Hawaii. And I don't know how many on the call have been there before, but for those of you that have, you know that it is one of the most beautiful places on the face of the planet. I mean, when you're flying in there, it's just amazing. And the nature, everything from hiking to the beaches, and it's just one incredibly gorgeous place. But it didn't start that way. There was a lot of work that went on below the waterline to create this amazing place that we call Hawaii. And so what we're going to do today is we're going to dig into that. We're going to get below the waterline when it comes to patient financial engagement and understand what analytics you need to look at, what you need to be thinking about as an organization, so that you can truly drive to that beauty above, what we see when we land in Hawaii and when we get out and start enjoying the place with our family. So on the back end of the presentation, we're going to talk about modernizing that experience, creating that really unique, differentiated consumerism. And we're going to share some ideas around consumerism that's a little bit different. And so please stick around to the end of the presentation so that we can share these ideas with you. And that's when we're going to give you the answer to the trivia question, is at the very end. So we're super excited to be here. And with that, we'll get started. I'll pass it over to Reed to get us going.
Okay, great. Thanks, Fred. So obviously last year was a tumultuous year. Many healthcare provider-based organizations were really struggling to make ends meet. And as we came through that, we saw an accelerated focus on really cleaning up the revenue cycle management process. And invariably, as you start to get below the waterline, as Fred commented, a lot of the arrows started to point towards modernizing the patient collection process, because we've all heard a lot about the patient engagement and patient access that's really been in motion for probably 5-6 years. COVID just put that on steroids. So the patient wants safety, convenience, transparency. And what we really want to talk to you about relative to analytics is how do you get accuracy when you've got databases, billing databases that are burdened with years and years of financial data. And a lot of those situations end up really clouding up the patient's ledger, which then creates a bad payment experience. And so, as we really start to use analytics to understand your current state, then we can develop projects on how to effectively get to a good place to actually implement a modern patient collections process. And then what kinds of leading performance indicators, reporting can we put in place so that you actively can measure what's going on with your sort of reinvigorated RCM process to the benefit of making sure that you don't create those problems again. And, one of the areas that's fascinating to us as we work with large multi-state or, multi-specialty type of organizations or even single specialty organizations is how many of these folks do not have copies of the contract. The contract really stipulates how you're going to work with the payer's members. And the interesting thing about it is that many of these contracts stem from one template. I had a colleague tell me that he sees the common language across most payers. And a lot of those terms and conditions will get into things like having a signed consent before you can bill for certain services, and timeframes for eligibility checking. What are the responsibilities in relation to to patient collections, and actually the timing of the billing portion. So, we all remember 15 years ago when insurance only was a big focus for compliance reasons. Similarly, if we've got accounts that are not accurate, then you could have a situation develop where the insurance is really footing the bill, and that's not what they're looking for. They want patients to have skin in the game so they can help have a proper balance of utilization. And so those are things that we would encourage you, if you don't have copies of your agreements, that you reach out to your payer representatives so that you can get copies and start there. Another thing that we often see is that many organizations have stopped updating their fee schedule, which we typically recommend that you do that at least once annually. And so your charge master should be up to date. There's a lot of information that can come from analytics on what you really need to do relative to that charge master. And, part of that can start with, do you have CPT codes that are billed out and are paid in full? And are you routinely analyzing that? A lot of indications on what you can do to your charge master there. Similarly, as you go down the path, you can look at what are your payments telling you about your payer relationships. We find it pretty common that groups are getting not only underpaid, but also overpaid. So you can see in this analysis on the right-hand side, this one particular organization, which was a management services organization, was realizing $722,000 net underpayments on an annual basis. So this is an area where they can start to dive into understanding where in their revenue cycle management process are they missing the ball. And a lot of groups think that you have to actually have the payer fee schedules in the system to do these kinds of analytics, but that's not the case. As long as we can get at the data tables, we can pull this information forward and help to do some analysis and gather up some insights. The other thing is that, and this is quite, I'll say a boring topic, is key performance indicators. Often, commonly known, but really not commonly tracked. And there's usually excuses that come up. If you take, for example, net collection ratio, groups will say, well, our adjustments aren't really accurate. And, being able to track the non-contractuals versus the contractuals is not possible. So let's not even compute the net collection ratio. Well, we encourage groups to actually do that as a starting point. Again, we're trying to establish your current state, and let's give you the benefit of putting all those adjustments in that formula and see where you land. A lot of times you're still going to land beneath 90% of the collectible dollar, and you can do some quick math, a quick gap analysis to understand if you move that needle to be greater than 95 to 98%, you're going to have a material impact on your organization. And that ultimately results into a cleaner accounts in the system, which then translates into more accurate statements, not having to refund patients inappropriately and so forth. The other thing as we kind of go down the path is these exceptions that, are being created in the billing process, through denials and such. And so we like to make sure that you have the ability to track those and not only understand what your average days ignored are, or what your denial rate is. I mean, that's all good information. A lot of analytic approaches will give you that information, but the problem is that getting to the detail can be quite laborious when you're dealing with billing systems that are, have years and years of data built up. So we believe that your analytical approach, your tool, should be able to get to things like ignored denials based on an algorithm. And in this case, you're seeing over 9,000 ignored denials for a total of close to 1.8 million that have not been dealt with. And then, of course, we get to things like timely filing denials. Looking at a liquidation summary, certainly if you have the ability to have matched data and look at your charges and the adjustments and payments related to those original charges, that's going to give you insight. How are those outstanding monies being applied? Is it aging inappropriately? Are we waiting too long to actually close up, the cycle and the adjudication for those encounters? And so being able to trend that over time can be very valuable to the practice. And then as we look at further establishing your current state, do we have statements that are at risk? So we've got an encounter, patients come in, but we haven't actually billed the encounter. And do we have ignored statements? Do you have patients that are, receiving whatever you have, electronic statements or even paper statements, are they receiving those but really not, having any action? So being able to keep a pulse on that. And the worst case scenario you see like what you have here on the bottom, where you have this encounter number, they've received 73 statements for a balance of $85. That could be, if you're still doing paper statements, a substantial lost money that you don't need to spend. And the other thing is that you're also creating a bad experience for the patient. As Fred put up that one slide before we started, 70% of patients will switch their provider if they have a bad payment experience. So these are areas that, when you're doing this first step of analytics, establishing the current state, these are some of the areas that you can look at and really get some insights from as you do your analysis. And then ultimately, you're going to be looking at your patient collection success. I wonder how many groups right now or organizations are monitoring the opportunity for patient collections and our performance. So we're tying back the collections to the actual data service of the charges, and what percentage are you realizing? The goal is to get to over 90%. That's what we see our top performers doing. And being able to track this, trend it, on at least a month-by-month basis is really important. And you can even do a derivative of this of where you're looking at how many of those payments were actually done at the time of service. Great trend to look at, and then we can look at a little further down the road on why, what types of payments are being made at the front end, and are we really moving in the right direction? So once we've established the current state, we can look at determining projects to help clean up the revenue cycle management billing database so we can prepare for modernizing the patient collections and ultimately the experience. And determining going forward projects, a lot of these projects often get put on the back burner. So things like dealing with your credits. Invariably, organizations are mired down in the billing process, and these kind of things get kicked to the back burner. Things like old patient credits. Does a patient have a credit with no associated transaction over 6 months? Do you actually have statements that are turned off at the account, the chart, the encounter level, the statement level? Being able to track those and go back, handle the issues there, get those statements turned back on. And what's going on with our budgets? Are we increasing the amount of budget? Certainly with all that we dealt with over the past year, we're seeing the trend towards more budgets being active. And Fred and HealthPay24 can talk to you about the mechanisms they use to make that very easy for practices and their patients. Also, unapplied credits. We all know that unapplied credits don't have anything to do with netting out the patient's balance. So, making sure that these get addressed and applied appropriately to the transaction are where we need to place needed resources. And when you look at credits, typically you're going to want your credits to be less than 2% of your accounts receivable. And that's how we still run into groups that are not routinely refunding the patients or the payers, both of which could be illegal. So definitely want to get back to this as we see a lot of even physician practices not making those refunds because last year was so tough. I think one of the most recent articles I read was that primary care physicians on average lost close to $70,000 last year going through the pandemic. And when you look at that across the balance of primary care physicians in the country, that's close to $15 billion of loss. So, a lot of these kinds of projects, fell out of favor. Also looking at things that are in the patient's ledger that are, again, going to cause the patient to maybe get a refund when they should have. Things like double adjustments. So we believe you should look at if a particular CBT had an adjustment code and then the same adjustment code applied at a later point in time. Looking at credits with bad debt. How many patients have bad debt yet have credits on their account? So, tying those two together, again, helps to clean up and prepare for sending cleaner statements. And then how many CPTs are being paid in full? This goes back to the fee schedule point. So now that we've looked at, establishing current state and then developing projects to clean up the database, now we want to look at, analytics to support a patient-centric approach. And here's where we're really using a holistic view and, looking at your database and being able to really identify where you should be spending your time. So if I can show you this example, this will give you an example for how we like to see analytics. Okay. Okay, great. So in this situation, wouldn't you like to be able to get into your database and understand today what claims are at risk, right? Which ones have had no activity for 45 days? Which ones have had a note, but still there's no follow-up? So being able to quantify that, in this case, the total at risk for this organization, over 17,000 encounters, totaling over $2 million, 20% of the outstanding balance in your AR has not been addressed. They are entered into the danger zone. So once they hit that danger zone, you're at risk, obviously, for timely filing situations. And so being able to click on the blue hyperlink, get down to a report and show those individual encounters, again, helps you be proactive in making sure the claim is fully adjudicated, benefits are fully realized for the patient, and therefore they're not being billed inaccurately or creating burden for your staff, in the form of unnecessary refunds, et cetera. And then getting down to detailed reports that can help your front office. So if you have multiple offices looking at, so in this case, how much money was for dates of service, for that current date of service or within 8 days of that current visit versus money that was collected on dates of service prior to those timeframes. And then as we look out to future weeks, what was the opportunity, or what will be the opportunity to collect patient AR and even patient bad debt, and providing this information out to these offices so that they can collect these monies from the patient or even communicate with them in advance. And then what are your denials telling you? When we look at our patient AR analysis and we look at those monies that are coming in, how is that aging out? Do we have particular offices that need education on their business practices, how they're communicating with patients? And, as we see here, 62% of those monies that are being collected are going to, deductible, co-insurance, and copay. But it's interesting to note what other categories are we collecting those monies from? Self-pay, eligibility issues. These are all good indicators that tell us where we need to spend time either providing information, training, or updating our business practices. And getting comprehensive reporting, in a form that, if we think about the practice management systems, the billing systems that are, typically your operators and your billing staff are working with, it's very difficult to pull all this information together. If you think about following up on one particular encounter, how many fields would you actually have to access? So what we have done is prepared the ability to look at over 50 different fields that you might have to tap into. Things like, do we have balances that are in COB1 when they should be transferred to the patient? Things like, when was the last statement sent? What's the last encounter note that was posted? Just what was the last activity on this encounter so that people can quickly resolve those issues and you can keep your billing database clean. And then doing things like waterfall reporting. So for my dates of service, say in March, when were those monies coming in? And as we trend that over time, do we see a situation where we're still kicking our follow-up, our AR follow-up team, too far downstream, which is the practice's margins nowadays are so thin that we really can't be doing that any longer because it's costing the practice too much money. When you look at an average primary care practice, their profit margin is going to be in the 12 to 13% range. So when you start having things like 85 statements going out for the same balance, when you have those kinds of cost building, and you really start to affect the ability of the practice to continue as a going concern and service the community. And then looking at even your bad debt, over the years, how is your bad debt trended? I mean, certainly we've seen an uptick of that with the pandemic. And then looking at the bad debt aging and looking at by practice and by location. Again, this information is helpful in knowing which offices are doing well with updated and modernized collection practices and which ones still need support. And then, ultimately getting to a point where you're creating leading performance indicators. So, having time of service collections goals of collecting 100% of copays, greater than 80% of outstanding balances, and greater than 75% for all other time of service payments. And really keeping those error rates below 2% is the goal that we like to see for groups going forward. So at this point, I wanted to ask you, how would you rate your current patient collection success? So if you can answer this poll, we'll give you 30 seconds to respond to it. And we'll see, it'll be interesting to see how many folks feel confident about their current processes. Okay, we'll just give it 10 more seconds. All right, so seeing a pretty good balance of less than ideal. A lot of folks setting up for focusing on that in the coming years, up for 2022, and then currently a priority. That explains why we have such a high folks attending this webinar. And then we have a certain percentage, less than 5% feel like they're really being innovative at this time. So very interesting, Fred, when you look at these kinds of statistics, lots of groups really wanting to focus on that patient collections process. So I'll turn it back over to you, Fred.
Absolutely, and I agree with you, Reed. I mean, that's exactly why as we engage with these strategies, really need to understand the gravity of the problem before you can start, like we talked about below the waterline, the Hawaii example, before you can really come above it and really develop something that's unique and differentiated for your organization, that modernized process, and really drive into true consumerism. So we'll talk through that. So how do we do it? Well, first of all, we need to understand why. Why should we change? And this was a study that was done last year around this time. It was the 2020 CAQH index. And the stat that stands out the most to me is the bottom one, where approximately $30 per patient encounter can be saved with fully electronic transactions. So that means we need to look at this holistically. We need to look at it through the entire revenue cycle, not just in one particular section. The interesting thing is when you look at the revenue cycle, it really wasn't designed for patient engagement. It was designed to collect the $20 copay from a patient that maybe had a $500 deductible. And the lion's share of your margins were coming from the payer. And that's changing rapidly. When we meet with organizations today, and we've seen studies, anywhere between 30 to 40% of your revenues now are coming from the patient. And I know it's difficult to collect from the payer. I mean, I know we're fighting denials and underpayments and all those type of things, but at least there's an adjudication process. There is no adjudication process with the patient. And so you've got to think differently, because you got to think, how do I engage with them? How do I think like they think and engage in ways that they accept and understand? Because at the end of the day, to win at this, you've got to build trust. And that's what patient engagement and modernizing the process is really all about. And it's also about building a strategy. So one of the things we talk with folks about all the time is truly, what is your strategy? And it starts with what Reed was discussing. You've got to start on the back end. You've got to start with your organization looking internally at your existing processes and assessing that and building governance around that and understanding how to train your people to engage and why they need to engage and why they need to have these conversations with patients and what impact it actually has on the financial viability of the organization. To understand how we need to modernize certain processes and keep certain processes that we have the same as they are, but make them better and more efficient, and how to leverage technology, because I think, the rip and replace is not an option today. It's all about how do you leverage your existing platforms and make them stronger? How do you create better integrations to be able to drive to better performance for your organization? Once you level set on this, now you've got the building blocks to continue to grow and truly develop a financial engagement strategy. So where we're going to go next is we're going to talk about how do you engage with the patient. We're going to assume that we've done these things in the background. We understand exactly what we need to solve for, where the gaps are in our process. Now we're going to start engaging with the patient. So this is all about how do we communicate? How do we overlay the communication strategy with our revenue cycle? When you do this really effectively, you're able to deliver it, and you deliver it consistently. You're able to build trust, which ultimately leads to loyalty. And we're going to talk about loyalty at the back end. It also drives something that we call at HealthPay 24, situational fluency, where that when you start understanding what areas that you need to address first, now you understand how to connect at different points within the revenue cycle, within the patient payment journey, and what choices and options do you provide. This is when you start having a true impact on revenue. And then finally, we're going to introduce a concept around commerce. And how do you innovate? How do you engage cultures, behaviors, understand insights that you're pulling out of the system to be able to pivot and change and understand where do you adjust and how do you drive a differentiated conversation with your consumers. So with that, let's get into it. So let's talk about typically when we engage with an organization, what we see. A lot of times organizations are talking about post-service, and they're looking at it, so they'll go through the claims adjudication process with the payer. They're looking to maybe reduce statement costs, so they'll provide a portal to be able to make payments. They'll present opportunities for prompt pay discounts, for payment options, non-recourse revolving lines of credit, whatever it might be, to try to engage with the patient to get them to pay through this electronic process. The challenge with waiting to engage here is that you miss the opportunity to build trust early on in the process. It's also, you run the risk, and we hear it all the time, Reed was talking about it. A lot of times it's where you have the highest bad debt. And it is the lowest form of consumer engagement when it comes to really rethinking how do I overlay over the revenue cycle. We talk to organizations that are focused on point of service, where that, when the patient comes in and engages with them, they have that financial conversation with them. Maybe they provide them with opportunities for, again, lines of credit, those type things. This is a little bit of a challenge as well, because let's say that you've got an individual that comes in, and here it is May. They haven't had any healthcare related issues up until now, and they've got that high deductible plan. They got a $2,500 deductible, and now at the point of service, we're going to have a conversation. And let's say that you've asked your front end folks to collect 50% up front. That's a very difficult conversation for a consumer, especially when they're unprepared. And it's a missed opportunity to engage digitally earlier on to have that conversation. And it truly lacks a pre-engagement strategy. A lot of organizations out there today, and probably vendors have talked with you about, you got to start with pre-service. You want to engage with them early on. You want to be able to present them with an estimate. You want to communicate with them digitally. You want to have, whether it's through texting, providing that portal, having conversations, again, about payment plans, prompt pay discounts, maybe non-recourse revolving lines of credit, all those type of things, having those conversations early on in the process. And we agree with that. We think that's a very important time to engage. However, there's challenges around that, and we hear it quite often. Let's say that you've got an individual that has come into your organization, and again, they haven't paid anything in yet. They haven't had any healthcare-related issues, and let's say that you're an orthopedic practice, and they've come in and you present them with an estimate, and you start engaging with them digitally, and you're texting them, and you're providing the ability to be able to pay through the portal. And they make a decision, you know what, I want to go ahead and make my payment on this. So they make let's say a $2,000 payment. And then because you guys are starting to return to your, maybe post-COVID elective procedures, you're booking out. And so let's say that orthopedic procedure, now it's May, and you're not able to actually schedule them until August or September, and something happens and maybe they have an accident, they go to the ER, and maybe they're doing point of service collections. They collect 50% of their deductible. Now when the patient comes in for their procedure, they have a credit. And so you need to make sure that as you think through this, that you're not running into collection management challenges. And that's something that's very important for you to think through in regards to implementing a system that's focused primarily on pre-service. Reed, I know you've dealt with this, and especially on the physician side. I think you've seen quite a few instances where this can become problematic.
Yeah, and a lot of that goes to what we were talking about with unapplied credits and just having a patient's, essentially their ledger, out of sorts. They could have incorrectly identified responsibilities. The balance could be sitting in COB1 when it should be transferred to the patient. They could have bad debt out there and credits not applied. But when they could have duplicate patients. We have clients that have grown so fast, made acquisitions, gone into different states, and they have situations where they have duplicate patients or situations that prevent the front office from having accuracy and transparency into what the patient responsibilities are. So being able to communicate that patient becomes very difficult, especially when you have a line of patients waiting for you. And even if you're doing a financial clearance process that's a few days before the patient arrives. So again, this is what has led us to having this webinar as we get underneath the hood on doing these assessments and analyses. You've really got to take the time to clean your house before you're going to really be able to have a good experience for your patient clients.
Absolutely. So, what we need to really push toward is looking at this holistically and delivering a holistic solution where that you're prepared on the back end. You've got systems in place to be able to address those challenges around refunds, credits, those type of things. You're having that communication early on in the process. When they come into point of service, it's just a continuation of that conversation all the way through the back end. When you get this right, you're building trust early on, you're improving communication through the entire journey, and it's ultimately leading to loyalty. And we're going to talk about the impact of loyalty and how that's really can make a difference with your organization. So we talked through the governance piece. We just talked about the communication piece with the patient. We've talked about creating that situational fluency where you're having conversations through the entire process, giving you the analytics to understand when to have different conversations at different times. What we're going to do now is we're going to talk about taking it to the next level. How do we drive to a true commerce model? How do we really create consumerism and engage cultures where the consumer lives today, impact behaviors, and leverage that insight to drive a differentiated conversation? So really what we're talking about is, man, how do we move and live in paradise? So when we think about consumers today, they expect to be more connected to you. This was a Pew Research study that was done last year on U.S. adults who own cell phones and who own smartphones. I would say that if we do a poll question right now, there is probably nobody on this call that does not own a smartphone. So the level of connection is expected today. And then you look at what they expect from you from a healthcare perspective. We just went through the pandemic. A number of Americans opted for virtual care. They had to. And 70% say they never want to go back. So they want that connected experience. 80% of consumers have used the internet to make healthcare-related searches in the past year. This comes from a Guidehouse study. 63% of consumers will choose one provider over another based off their online presence. So think about that. That definitely would not have been the case 4 or 5 years ago. And 60% of consumers expect their healthcare digital experience to mirror that of retail. So we're going to talk about that. Let's talk about an organization that's done a phenomenal job of making that work, really meeting the habitually connected consumer's expectation. So obviously this is Uber, and the disconnected experience is on the left, and we've got the seamless connected experience on the right. So I want to paint a picture for you. Imagine it's pre-COVID, you're in New York City, it's 5 o'clock on a Friday afternoon, you're trying to catch a taxi to get to the airport to catch a flight. So if you think about it, the means of communication here is the waving of a hand and looking at the light on the top of a car. So this individual has no idea when somebody's going to stop, has no idea how much it's going to cost, doesn't know when they're going to arrive at their destination. When they get to their destination, the payment methodology is definitely not pandemic friendly. It's the swiping of a credit card or the exchange of cash. And when you think about the brand loyalty here, I mean, it's basically, if you ask for a receipt, then, you know what the name of the taxi is, but are you going to call that same company the next time you're in New York? You look at how Uber has truly revolutionized that. It's always on, always connected. So like in healthcare, I can schedule that pickup. I know how much it's going to cost. I know when I'm going to get to my destination. If I have a bad experience, I can communicate that. If I can't seem to find my Uber, I can communicate it in that manner as well. When I get to my destination, I know when I'm going to get there, and I can pay in a very seamless way. And so when you look at what this has done, it's opened up a whole new world of opportunity for Uber. So this is their breakdown of their segmentation, their revenues. And the interesting thing is that mobility or rides is no longer their number one revenue producer. It's actually Eats. But that wouldn't have happened if they hadn't built that brand loyalty through rides. And so when you think about that and how that applies to healthcare, many of the folks on this call have gone through price transparency. And we all know that that's an attempt to commoditize the actual service of healthcare, to drive down the cost. So we need to start thinking about commerce and how to build services around the actual encounter. So as you think through that, we see the real next phase of this as you think about your platform and your modernizing and creating consumerism is really creating a Shopify experience for your patient and provider, for you as a provider. So what does that mean? Well, it's really three areas. So think about from a commerce perspective. I'm sure we've probably got some folks on here that on ophthalmology clinics or audiology clinics or dermatology. Think about all the services that you provide outside of patient care. Probably, contact lenses, glasses, hearing aids, batteries, ointments and creams as a dermatologist, all those type things, creating that exact same payment experience for your consumer when it comes to paying their patient payment obligation, having that same experience for the GL items and being able to provide that same level of consumerism to them in regards to discounts, communications, coupons, all those type things. We're talking to an organization right now. It's a small hospital. They have their wellness center doubles as the gym for the local town. And so they want to be able to sell memberships and yoga classes and birthing classes and all those type things through the same integrated platform. So think about all the possibilities around that, all the way down to something as simple as your gift shop. But it needs to be that same integrated experience. Think about it from a compliance perspective. Care plans. Think about that orthopedic procedure that I discussed earlier. You got DME around that. You've got pharmacy. You've got the rehab associated with that. Being able to leverage a single platform for all of those patient payments, or all payments. Think about it from a value-based care perspective. Think about possibility of meal plans, transportation, all those type things that can help drive down cost. And then steerage. Can you, for those areas where the payer is leveraging steerage to trying to drive the consumer to a lower cost option, can you leverage your patient payment platform to be able to control that by providing better options? And then ultimately what it does lead to is convenience. So that single payment portal for both your patient and for your provider on the back end, for you guys. And then the ability to be able to reconcile all payments and basically become all things healthcare to your consumer. So what does that digital front door really look like? So this is a best practice around that. So we haven't really talked a lot about this, but obviously it's got to be compliant. It's got to be PCI compliant because you're accepting payments. It's got to be HIPAA compliant. It's got to meet all the regulatory compliance things so that you help that patient feel more comfortable and secure in leveraging that platform. It needs to be a branded digital experience. So creating that connected consumer, connected back to you. We use the Uber example. Everybody knows what the Uber symbol is, right? So you want to create that exact same experience for your organization. So this means involving marketing in these conversations to understand how do we do that. We talked about pre-service estimates, engaging pre-service, being able to present, the cost early on, billing payment options, those type things. Really what you're trying to do here is promote peace of mind. The sooner we can get that conversation out of the way, the sooner the patient can think about getting better. And then expanded services, what we just talked about. How do you bring in those other things that are a part of your organization that drive revenue that you want to create that same experience with the patient, just like we do with Amazon and some of the other things that we use in our personal lives, being able to provide promotions, discounts, all those type of things that lead to developing brand loyalty. And then, as Reed talked about, the analytics for insight to keep the finger on the pulse of your consumer, be able to drive that. All right. So to wrap things up, let's talk about where you are in this process. This is the innovation in S-curve. It's something that technology companies use to really talk about adoption. So on the one axis, we got performance and adoption. On the bottom axis, we got time and improvement. So think about where your organization is today and all the things that we've talked about. Everything from how do you evaluate where you are today to where are you with your engagement with patients in the revenue cycle, pre-service, point of service, post-service. Are you thinking about how to truly engage from a consumer perspective, creating that Shopify experience, one single integrated platform to be able to scale your organization? Where are you? Are you thinking through it, trying to understand really at the bottom, you're looking at your current technology and processes and paradigms, but don't feel that you're quite there yet? Or are you on the upper end where that you've kind of gone through this process, thought it through really well, you've implemented new technologies, processes, you've made that paradigm shift, and you feel like you truly are consumer financial engagement, you've got a really strong plan going on? Or you're in the middle. A lot of conversations that we have today, we find people there where they've done certain components of this and they're trying to figure out really how to piece it together and to understand, do they have the right metrics in place, the right KPIs that align to organizational outcomes? Because at the end of the day, that's what it's all about. If you can't see organizational outcomes, it's not worth doing. So if you find yourself anywhere in this, especially if you're in that middle, we're going to provide some information in just a little bit about how to contact us. Happy to come in and do a agnostic assessment. Is not tied to any particular product with you, to help you think through a business case in regards to how you want to engage with this. You'll see our contact information for both Reed and myself in just a few minutes. But before we get there, I want to ask a poll question. So how would you rate your current patient financial engagement as it relates to the journey toward consumerism? So think about the graph that we just talked about. Less than ideal, on the radar for 2022, currently a priority, or innovative? And we'll give everybody a few minutes to answer that, or a few seconds here. All right, just a few more. All right. Well, that doesn't surprise me that it's a current priority. We hear that quite a bit when we're out meeting with individuals. And less than ideal. Again, happy to meet with you folks and have those kind of conversations and understand what we might be able to do to help you to provide the right analytics around that and think through that process. On the radar, and then innovative. And congratulations to those of you that have really hit that level of innovation. But we'd like to help everybody get there if that's possible. So we really appreciate your time today. We're going to answer some questions, but we're going to find out the answer to our first poll question around how many miles of coastline does Hawaii actually have? Over 1,100, wow. Actually, it's about 750. I figured you guys had all this time to Google. You would have probably figured that out, but absolutely. So what I hope for everybody that joined here today, that you do get an opportunity now that restrictions have relaxed, to get out with your family and enjoy life again. I know it's been a tough year for us all. And I hope you're thinking through, where do I plan my next vacation to get out with friends and enjoy life again. So we really appreciate the time that you spent with us today. And we're gonna wrap this up by addressing some of the questions. I think we still have about 10 minutes left. So I'll turn it back over to Erica.
Thank you, Fred and Reed, for a great presentation today. So we'll go ahead and looks like we've already got some questions in here. So the first question is, you've talked a lot about pre-service, point of service, and post-service. So up to Rudy, where do you recommend we start when implementing our strategy?
Hey, Reed, I think I can take that one. I think that, the graph that I shared a little bit earlier, I think that's a great start, is really to understand internally in your own organization, what are the priorities, where are the gaps, and how do you really build out that strategy, whether you do it internally with your own group or you work with somebody like us to talk through that to figure out where are the opportunities for the greatest opportunities for improvement. Anything to add, Reed?
No, I think you got it.
Awesome.
Thank you. So next here is, do these techniques that you've discussed apply to physician practices as well as hospitals?
I can take that one, Fred.
Okay.
The idea is that the challenge at the front end is different as emergent needs to be treated and payment options are discussed after ensuring that the patient, the family, once stabilized, has the opportunity to pay their deductible. And you're conditioning the patient to pay if they don't meet any other benefits. So many other metrics can happen in the hospital as well as the physician systems and need to be investigated and quantified in a software like, what we put together here at Bugle, so that your hidden revenues and corrections are transparent. Now, that's the key.
And next here, the attendee is asking, what strategies have you deployed for point of service collection in infusion center and radiation oncology locations that often have daily recurring appointments over weeks?
Okay, you want me to take that one, Fred?
Sure, Reed, go ahead. I can jump in too. Go ahead. Go for it.
Essentially, point of service collections, for infusion and radiation oncology is knowing who's arriving for the day, what do they owe, and how much of their debt is not currently in a budget plan of some sort. That's typically, what we are working on with our clients in that area.
Thank you. Just filtering through here. The next question is, how do you see a payment strategy helping us handle the demands of the post-COVID surge we're seeing at our practice?
You want to take that one, Fred?
Sure. Well, I think we kind of talked a little bit about that in the example with the orthopedic practice. I think it's a situation of where that you need to think through, like, when do you engage and how do you, obviously the sooner that you can engage with the patient, like we just talked about, and you can start collecting those payments, those patient portions of the payment early on is critical. However, you need to make sure, as we talked about, that you have the back end support to be able to do daily reconciliations, that the platform supports the ability to be able to do that. Because one of the biggest mistakes that we see most often is the back end is not capable of being able to process those credits and refunds, and it actually creates more of a challenge for the organization. And so you definitely want to make sure that whoever you choose as you're making these decisions, that it has the ability to not create more of a burden on your organization as you're starting to collect those early payments.
Sure. Thanks so much for weighing in there. Next is the attendee asking, timely filing is a tool for insurance to avoid paying. And according to contract law, the statute limitation is 7 years. How do you overcome payers who are abusing it?
Yeah, so for payers that are, abusing TFL, essentially you have a contract and an extreme measure is going to the state governing board. So for example, the Texas Medical Board, if you do have someone that is abusing it in that way, that's actually typically what we've seen with our clients.
Next here is, are our EHR gives us our analytics. How could we seamlessly use your platform so that we're not double entering?
Read from an analytics perspective, can you,
Yeah, can you repeat that? I'm sorry, I missed that one.
Sure. The question is, our EHR gives us our analytics. How could we seamlessly use your platform so that we're not double entering data?
so
Yeah.
I could. It would depend on. I think regardless of any platform that you use from a patient payment perspective, I would assume that the platform is capable of integrating with your EHR. If you're looking at it from a payment collection perspective, there are, I can just only speak for our organization. We are integrated with quite a few practice management and EHRs. And so there's a couple ways you can address it. You can look at collecting the patient payment portion through the EHR integrated into a platform like ours, or that's very doable. If that's something you're interested in, we would probably need to have a conversation outside of this on that. But from an analytics perspective, Reed, on your side, how would that work?
Yeah, so you're really not entering anything into the analytics platform. The analytics platform is pulling the data from the SQL tables. So, being able to come in the morning with your cup of coffee and look at your newspaper of all the things that are most important for you to focus on is how our clients use Bugle. And it's because you can actually drop down into detailed type reporting without having to go back to the billing system or EHR is where the power is. I mean, we even have one client, again, management services organization, and this is kind of, it sounds a bit odd, but she was telling us that she even dreams of putting reports together when she's in the shower. And that's the kind of thing that they use, the analytical platform for.
Thank you both so much. Looks like we'll have time for one more here. So the last question, can you just do you have an example of how others have utilized your payer payment analysis?
Yeah, so that's actually, I would really encourage everyone to do this because it is so rampant out there that these underpayments are going on. With one of our clients that we had in the Southeast, they actually realized a $515,000 settlement. It wasn't even, sort of reprocessing the claims. It was an actual, large check that was cut to the medical group. So, know that this is going on. It's got compliance in it. It's got not only underpayments, but overpayments. And it really can help you in optimizing your revenue cycle management process. Huge return with that exercise. And again, you do not have to have the payer fee schedules in the system to do the assessment and analysis.
That is all the time that we have left for today. I want to thank Fred and Reed again for an excellent presentation and to HealthPay24 for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console, and please also fill out the post-webinar survey. Thank you so much for joining us, and we hope you have a great afternoon.
Great.
Talk soon.